Good afternoon, everyone. Thank you very much for joining Healthmonics today. We will be going over MIPS 2021, maximizing your MIPS performance. Today, I'll be joined by our MIPS partnership consultant, Robert Stout. The two of us will go through the entire presentation and we'll have some time at the end for some questions. A couple of things to go over. The GoToWebinar widget on the right-hand side of your screen has the ability for you to ask us questions, as well as a couple of handouts for today's presentation, including the slide deck that we are going over. So today we're going to review three things. First, we're going to start off with a little bit of a review of MIPS 2021. This is a very beginner to MIPS understanding of what it is. We're not going to spend a lot of time on that. And then we're going to move into tips on how to maximize your return and avoid the penalty. Both are going to be covered in detail during this presentation. And then at the end, we're going to show you how working with us at Healthmonics can help you with your MIPS reporting moving forward. So I'm going to turn it over to Rob, and he's going to take it for the next couple slides. Thank you.
Thank you, Mike. So this is the general overview of the 4 categories of MIPS in 2021 and their respective weighting. So quality is still king in 2021, making up 40% of your total MIPS score. And this reflects the CMS's stance that MIPS focuses on quality reporting. You won't see any difference in the weighting between promoting interoperability and improvement activities. PI stays the same at 25%, and improvement activities, or IA, stays the same at 15%. Cost has increased from 15% to 20% in 2021, and this is trending towards cost to keep increasing in its weight as it coincides with the CMS's budget neutral directive. And it is expected that cost will keep rising each year as quality will start to decrease going forward. Now, the weighting of these 4 categories will make up your total MIPS score. If you score between 0 and 15 points, you will receive a negative payment adjustment of 9%, and this will appear on every Medicare bill in 2023. If you score between 15 and 59 points, you will receive a negative payment adjustment somewhere between that negative 9% up to 0. Now, 60 points is where you would be avoiding any penalty. However, you would not see any positive financial incentive. So you would have to score somewhere between 60 and 84 points to receive a positive payment adjustment that's greater than just 0%. But it is still not considered exceptional performance. The exceptional performance range is from 85 points to 100. And the maximum incentive in 2021 that you could receive for scoring a perfect score is 7.36%. Moving on to the eligibility for MIPS, there are really 3 overarching factors that could cause a practice or provider to be ineligible for the MIPS program in 2021. Meaning that they would be exempt. So the first is if they were newly enrolled in Medicare as of this calendar year. And the second is what's called the low volume threshold. What is considered low volume is if you bill less than $90,000 in Medicare Part B charges, or you see less than 200 Medicare Part B patients, or do less than 200 covered professional services. And the last factor that could cause you to be ineligible for MIPS is if you are an advanced APM participant. On this slide, we're going further into the changes of quality measures from 2020 to 2021. So the columns across the top read as number of measures finalized as new, number of measures finalized for removal, number of measures finalized with a substantive change, and number of measures remaining, so the total quality measures. You'll see that there are only 2 new measures that come as administrative claims, and there are 14 measures that have been removed, with a bulk of those coming from the MIPS CQM specifications. And the number of measures with a substantive change to that, there's 113 measures. Again, a bulk of that being the MIPS CQM specs. So for the total number of measures remaining, it's just around 201 for 2021, or 209, sorry. Going into promoting interoperability, really nothing has changed from 2020 going into 2021. The only thing that we ask you to please note is that the security risk analysis measure is still required. However, it's not going to be scored. Improvement activities is very similar to PI in regards that it hasn't really changed from 2020 going into 2021. Practices still need to report on at least 50% of the clinicians in the group, and any activity that you choose to do must be on a 90-day continuous performance period. And as always, if you are an APM participant reporting through the APP, you automatically receive a 100% in improvement activities. So for the people who have to actually report for improvement activities, if you are in a practice that has 15 or less eligible clinicians, you either have to do 1 high-weighted activity or 2 medium-weighted activities. If you are in a larger practice, which is considered more than 16 eligible clinicians, your options are to do 2 high-weighted, 1 high-weighted and 2 medium, or 4 medium-weighted activities. Going into cost, there are 20 measures spanning across the total per capita cost, the TPCC, the Medicare spending per beneficiary, which is MSPB, and 18 episode measure. So the TPCC attribution changed in 2020 to be more closely based on primary care services. So some provider types have been eliminated from attribution. And MSPB changed in 2020 to better attribute medical and surgical episodes. And all MIPS cost measures are scored based on a patient's risk score. In this slide, we are looking at the minimum threshold to avoid the penalty from the year that MIPS came into its inception, all the way to what we're projecting for 2022. So as you can see, in 2017, you just needed a measly 3 points to avoid the penalty. And I'm sure 100% of us now wish that that were the case, but ever since 2018, it's been jumping up in 15-point increments. So starting in 2018, it was 15 points, 2019, 30 points. And then the big jump from last year is that the minimum points you need to avoid the penalty went up from 45 to 60 points. And as you can see, it's estimated that it's going to jump another 15 points essentially going into 2022. So we really advise that this is the year that you take MIPS as seriously as possible to try to bunker down for the storm that is going to be 2022, and try to put all of your effort into 2021 reporting, because 60 points is not going to be as easily achievable, obviously, as 45 points, but we are going to be here to help get you there. And Earlier when I was talking about the financial incentive or possible penalty, you can see here this is a sliding scale of the total adjustment. If you did score 0 out of 100 points, that would net you a negative 9% on every one of your Medicare bills in 2023. And you can see that that adjustment rises, and when it hits 60 points, I know it looks like 55, but it's 60 points, that would get you a neutral payment adjustment. And then after you score more than 60 points, you can see you're starting to get more of a financial incentive, all the way up to 7.36%. I'm going to hand it back over to you, Mike, to go over strategizing to make sure that they do reach those 60 points.
You got it. Thanks very much, Rob. So 2021 marks the first year that full participation is required to avoid the penalty. So I like to say there's no easy way out of this program. In previous years, I've shared during this presentation that there were little tricks to the trade to get your way out of avoiding the penalty. I'll go over some of that information moving forward in today's presentation, as well as you can call and talk to us on the phone about what you need to do. But from the most part, there isn't an easy way out moving forward. They are truly trying to make it so that half the people are paying into a penalty and half the people are receiving an incentive through CMS. That's why we see for 2022 that jump to 74 points to avoid the penalty. So a couple of things to keep in mind as we're trying to avoid the penalty, and we'll get into the incentive and exceptional performance rates in a little bit, but this is avoiding the penalty the next few slides. So with the cost category increasing to 20% this year and 30% next year, your direct control over your score has been reduced. You can make an impact on your cost score, and we do have some ways here at Healthmonics to help you with that. But from a standpoint of reporting your information, your control is on the other three categories. So by it being at 30 points for next year costs, you can see if 74 is the threshold to avoid the penalty. If you do poorly in cost, you will be penalized for the whole program. Now, one of the important things to understand, and there will be a very large difference between everybody here on this call today, as well as everybody else that is reporting MIPS, is that there are category exemptions that will play a pivotal role in what participation level you are required to report at. So whether you are, for instance, in this first scenario that you see here, you are exempt from the promoting interoperability, whether that is you're a small practice, or you may be a non-patient facing provider, or even some of our psychologists, PTOT, audiology, those type of providers, you'll be exempt from the PI category. So with that, all of those points move into quality. The other example I have on the right-hand side are those that are exempt from both PI and cost. And there are a lot of providers that may have been dinged with a cost score in 2019 that would not be hit with a cost score in 2021. So for 2020, they got rid of costs altogether due to COVID, but for 2021, it's in there with the score, but it has been limited to a number of different provider types that we'll go over on a later screen, and it's also available to you in the handout that we have provided. So how do you get to 60 points? I'm going to go through some boring math here, but it's very helpful to figure out how you need to get to 60 points to avoid the penalty. As I said, remember, there is no easy way out. So if you take a look at this graph, you can see what it takes to get to 60 points across each of the different options and categories that you may need to report under. So the first one on the left-hand side is the no exemptions, and then you get into the no cost, no PI, and no PI or costs. I don't see many people getting any type of exemption for quality and or improvement activities, but if you do, please give us a call and we can help figure out the math for you, as well as as well as you doing it on yourself using the information you see here. So the idea to get to 60 points really is by scoring 50% in each category, as well as getting a perfect score for the improvement activities. To get 50 points in quality, a large practice must average a score of 5 points for every single measure. Now, the complex patient bonus, that little bonus I put down the bottom at 2.5 points, is not given. So, becoming more dependent on your quality and PI scores will be very important this year, as that 2.5 points, while I've averaged it, because you could get 0 to 5, you can't depend on it. So you want to make sure that you're shooting for like a 65 in your score, just in case, to cover yourself. And I'll go over that in the next couple slides as well. So for a small practice to avoid the penalty, there are a couple different scenarios. And what I've done is, how do you get to 50%? Obviously, with the complex patient bonus that we were discussing, you are going to want to shoot for a little bit higher than the 60%. The first category you see on the left-hand side, this worked last year. If you did 3 measures, if you did one measure each, one patient each for 6 different measures for a small practice, you got your small practice bonus points and included the category, including your complex patient bonus points and so forth, you would at least get close to that 45 points that was needed last year. Not 100%, but 45 points as it was for last year. That's not going to work this year. You're not going to get close to that 60. So there are a couple of different scenarios that you can take into consideration. The first one is doing okay on each of the measures. Really just doing okay, scoring a little bit above the minimum on each measure will get you to that 60-point threshold. Will get you to that 50% threshold. Sorry about that. And then scenario 2 is doing a little better than okay on 2 measures, so really concentrating on 2 measures, and then scoring the minimum for each of the rest. And then the third option there is to do really well on 1 measure, and then performing at the minimum for everything else. That will get you to the 50% needed for each of these categories. However, as I stated, you definitely want to shoot for more. So for large practices, it's even a little bit more difficult, because for large practices, you do not have the opportunity to get the small practice bonus. So those are groups that are 16 providers or more under 110. They would need to do the following to get to that 50% threshold. Now, getting the 50% in scenario 1, as you can see, you now need to get 5 in each of the categories. And scenario 2, you need to do well in 2 of them. And then in scenario 3, you need to do really well. So there's many different options on how to do that. The main things that you want to know about the large practices is that you need to report on 70% of all of your eligible instances to receive those 3 points. So it's not like the small practices who can get away with reporting 1 patient for a measure and getting the 3 points. For a large practice, you need to report on 70%. And once again, I'm saying it multiple times here, the 50% in quality may not get you to the score you need. Don't be dependent on the complex bonus. Strive for more points. Shoot for 55, 60% in this category, and that's going to help make sure that you avoid the penalty. So understanding the eligibility a little bit more, permitting interoperability, there is a small practice exemption. You can go to the CMS website, qpp.cms.gov, and take the small practice exemption. That is for groups of less than 15, and you want to be able to report on those. To not report on the PI, if you don't have a certified EHR, if your scores are going to be low, and so forth. If your scores are going to be good for your PI, you don't want to take the small practice exemption. That can really help you with the scoring. If you have a decertified EHR, you can get an exemption. And then there are a bunch of automatic exemptions that are available to you. If you work in an ambulatory surgery center, hospital-based, and that's based on a percentage of your claims coming from each of those locations, non-patient facing, or even some of the provider types I mentioned before, psychologists, audiologists, PAs, CRNAs, NPs, PTOT, as well as others. As for the cost categories, there were some major changes in who is eligible for the cost category, which we'll get into in a couple slides, but changes were initially made for the 2020 reporting period, and now that's carrying over to 2021. So once again, if you were hit with a cost score in 2019, that may change on 2021. Providers that may have gotten a cost score in the past may not get one, as I said. So who needs to worry about the cost category? So the first measure is the total per capita cost, otherwise known as the TPCC, and it has been updated for this year to a limit attribution based on E&M and other primary care services. So the providers that are listed below are the ones that will be in TPCC this year. If your provider type is not on there, there is the chance that you will not be docked for TPCC moving forward. I'd still say that you pay attention to it. You take a look and make sure that you are listed correctly through CMS of your specialty to make sure that you will be exempt for the TPCC. For MSPB, the Medicare episodes are attributed to any TIN rendering at least 30% of the E&M services during the index admission, and to any clinician who bills at least one E&M service that was used to determine the episode's attribution to the clinical group. So the surgical episodes are attributed to TIN MPI rendering any main procedure determined to be clinically relevant to the index admission. So what that is saying here is that there wasn't changes to this as far as who will get attributed these patients. There was on how it's getting attributed, and there are breakdowns on our website that you could look at on how it gets attributed to each one of the provider types. Last but not least, the episode measures on here. These are the list of the episode measures for 2021. As you can see here, there are a lot of provider types that fit into these episode measures. If you are one of these provider types, or you have one of these provider types within your practice or organization, they will be attributed most likely an episode measure score if they meet the minimum requirements for each measure. So pay attention to that, learn what these measures are, and if you need help on figuring out how to embrace those measures and work with that, please reach out to Health Monix for our support. So what are the steps you need to take right now to avoid the penalty? So the first thing is eligibility. Check for your automatic exemptions, file for your small practice exemption or other exemptions that are available, and really know what categories you need to score in. Measures, you still have an opportunity to choose some measures at this time. You can gather the data now, start tracking your performance today. It's not too late. A number of providers sign up with our program really late in the year. We highly recommend, with the minimal score for avoiding the penalty moving up this year and even more next year, to start tracking earlier in the year. Our system's up on January 1st of every year, so you come in and take a look at those measures and how you're performing. And I think one of the more important things that you need to do is a completion check. Look at what needs to be done. What would your score look like if you reported today? Do you have your 90 days set for PI and IA? If you do, write them down, get that done, get that ready to attest for. Work on quality. Quality is where you can make the largest impact, as it still has the largest percentage of your overall score. So the next couple slides that we're going to go over are some steps to maximizing your score and shooting for an exceptional performance. So a little bit about what exceptional performance means. So the exceptional performance threshold has not changed for 2021 reporting. It still is 85 points, and you must perform very well in each category to get to that point right now. As the penalty threshold increases, more providers are going to be paying into the program. So what does it mean when more providers are paying the penalties? That means the ones that do well are making more money. It is a zero-sum game here at CMS, and you want to be on the positive side of that. And that means scoring above 60 in 2021. The incentive curve also becomes steeper once you pass 85 points. As you saw on the slide that Rob was showing earlier, the increase in the percentage back that you should be getting based upon your score increases once you get past 85. Now understand also from that page when we were looking at the 7.36, that was estimated based on what CMS said the scores were going to be for 2021. That is not something written in stone. And as I said, the program is a zero-sum base. So that percentage will only be as high as those that are paying into the program. So those that are shooting for the exceptional performance and maximizing their incentives should be well on their way already. This is late in the year if you're shooting for exceptional performance. As I said, there still is some time, but you really need to get on the ball right now. So you should have already figured out what you're eligible for. You should have already known what measures you are tracking and have the system and people in place to help you successfully report. So what can you do now that we're coming up on June 15th? School is ending, summer is starting. What approaches can I have to my MIPS reporting to make sure that I'm in the right position for exceptional performance come the end of the year? What you don't want is to be scrambling in December and January trying to fix and complete your quality data throughout the last couple months of the year, when if you start now, you could take the steps to get you there right away. So learn what points are still out there to get. You want to make sure you track rolling 90-day periods for your PI. If you could get a perfect score in PI, look at each period. Don't pick a 3-month period. Don't say October 3rd to December 31st. Go and look at it and see if, September 17th to November 17th, whatever it may be, that's the 90-day period that you want to take a look at. It doesn't need to be a full quarter. It doesn't need to be a full month. Understanding the gaps in your data and start immediately implementing the changes to meet them. So right now is the great opportunity for you to really dig into that data and take a look at what missing information that you have and how you can better meet some of the measures that are out there. And just like in the people that are looking to avoid the penalty, start checking those boxes now. Get your security risk analysis done. Look into your improvement activities. Figure out your 90 days. For PI, do it now so you're not rushing at the end of the year. Look at all your exemption applications. Work with your team to prepare yourself as you move forward. So what points are still out there? Understanding some of the bonus points that we have, and we'll go through a couple of them on the next couple of slides, but reporting more than 6 measures can be an opportunity to score extra points. Utilizing a certified EHR to report. Improvement bonus activities are in quality, as well as you have your query of prescription drug monitoring available within PI, all available as bonus points. The other area besides bonus points that you want to take a look at are your gaps in your data. Are there measures you're not tracking or that you are not scoring well in? Or that you are scoring well in. So a lot of those measures can be measures that have small denominator populations or measures you weren't even thinking that you can control. But let's say you work at a hospital system and a provider in your hospital, as a provider in your hospital, you have access to information that shares if the patient has their flu vaccine, and that isn't a measure that you are looking to calculate. Well, if you have that information in your system saying that patient got flu vaccine, you can get credit for a measure like that. So take a look at things like that. Do you have poor scores in categories or two that can be tightened up before submission? So what do your measures look like in quality? What is your PI score? Is there something that you do? Can you reach out to providers in your local area to find out if you could send and receive messages from them so that you could get credit for each of those PI categories? Are you utilizing the right tools? This isn't the time to change your EMR right in the middle of the year, that's for sure. But are you utilizing a registry for reporting to gain access to more measures? Are you using a telehealth medicine system so that you can get all your answers that are needed? Do you have the ability to work with the right people? Do you have a consultant that you are working with to help you get the goals to the goal that you have of exceptional performance? So some of these slides are going to be review slides from previous webinars that we've done, but the bonus points and quality here, reporting extra high priority and outcome measures. So you can receive 2 bonus points for every additional outcome measure that you report and 1 bonus point for every additional high priority measure that you can report. And that's up to 10% capped on that. But what that means is that bonus points can be given for measures normally 7, 8, and 9, so you can report extra measures, and you will get just the bonus points added to your score. The actual score of what you're reporting doesn't count for those that aren't in your top 6. But for measures 7, 8, 9, you can get those bonus points, whether that is additional outcome or high priority. And if you're reporting those within your 6, you will get those bonus points after the first one. So the first outcome measure and or high priority measure will count, will not give you bonus points, but everyone after that you will. There's also the CERT bonus, so utilizing a certified EHR technology. Your data needs to meet end-to-end reporting requirements, so no data manipulation, and it comes directly from your EHR or directly from your EHR into a reporting mechanism like MIPS Pro. You can receive 1 bonus point per measure with a maximum of 10% of your quality score denominator. So by utilizing a system like ours, you can meet those end-to-end reporting requirements if we're bringing your information over via an SFTP or through an API integration, so different types of integration. And then there is an important improvement bonus potential, so earn 10 additional percentage points based on your improvement from the previous year, which can be very helpful for those that may have not reported well in the previous years and are starting to really take their quality reporting seriously. So the next area is understanding and attacking your gaps in care. So determining what is missing and seeing if it is stored elsewhere. There are lots of opportunities here that you can really work with, but verify that information. Like for instance, if your A1C results from labs are documented in a structured format, if they're somewhere else and you're not collecting that information, but you're shooting for that measure number 1, if we could find that information and bring it into a registry, or you can report it through your EHR and so forth, you can use that data to help you score. Make sure you're not missing out on measure performance opportunities, bringing your data from all places. We work with a number of providers that not only bring their EHR data, but also they need to be able to bring in their data from billing systems, from other sources to fill in the gaps in their care. Confirm your providers are documenting in the correct area. The number of times that I work with even as small as a 2-provider practice, and one provider is doing very well and the other one's doing poorly, but they both say they're doing the work that's need to be done, is because they are documenting it differently. A provider may be checking a wrong box or putting the information in a non-structured format while the other is putting it in the right spot, and therefore that's why quality differences are between the two. If you're reporting measures that need to only be reported once per performance period, this is an opportunity to take a look and see those that you missed the data, that you have the gaps in care, as you can see on the screen below, where you have gaps in the patient information, and take a look and see if those patients are due back in the second half of the year. And that will help you get to those that will help you close those gaps in care if you can pinpoint those patients that you might not have gotten the correct MET and answer for each one of those measures. So making your measure decision, this is a little bit late in the year to be making your measure decisions, but understanding your benchmarking for the measures that you're tracking. Make sure you're not tracking too many measures that are topped out or capped out, meaning that they can maximum you can get is 7 points or 10 points at 100% of your score. So take a look at each one of those measures and see how you're reporting. As you can see here, benchmarks differentiate between the ways you report, whether it's through your Medicare Part B claims for groups of less than 15, to your MIPS CQMs like a registry like MIPS Pro, or through an ECQM, which is either through your EHR, or you can also report ECQMs through a registry. The other one is, do you have measures like the ones listed below? Are you sure that you're tracking all applicable measures? You could have undetected measures at small denominators that you're not even tracking. So for instance, below, you see the psoriasis measure number 410. There's 15 instances and you're at a perfect score. However, no matter the size of your practice, for a perfect score, you need to get 20 patients in the denominator. So I see that question came up on here for these measures that you need to have a completion percentage, 20 case minimum, apply to both small and large. Yes, to get more than 3 points for a measure, you must report on at least 20 providers. 20 patients, 20 instances for each one of these measures. So for a measure like 15 that you see below, measure 410, 15 is not enough. You will only get 3 points if you report 15 over 15 for a small practice and a large practice. Also as well, for measure number 418 that you see here, this is a measure where you do have the 20 patient instances, but you're really being dragged down by not having 2 patients met. This is an opportunity to take a look at those 2 patients and see if you can figure out how you can get the correct answers for those patients and see if the data is in there and fix the information that's coming through and make sure that it is correct. Because a 20 over 20 for this measure, just by changing 2 patients and working with 2 patients to get the correct information, whether they're coming back in the end of the year and it's a once per reporting period or so forth, or the information's not documented correctly, but it's actually in the note, you can get that opportunity to move that over to 20 to 20. And that way you're going to jump a whole 2 points. So another important part about maximizing your score and getting the best score possible is understanding your scoring hierarchy. This is important for 2021 and moving forward because you can have multiple scores within your NPI that can impact your score. You could be part of an APM entity and you'll get 1 score, as you can see on this sheet, number 88. You get your score of 88. You can have a TIN score or multiple TIN scores if you're part of multiple TINs. And then you'll also can have your MPI score, individual MPI. So if you are let's say you are down at a 94 here for an individual score, you will get the highest of these 3 scores. So in this case, you'll get your own individual score. If you are one of these, let's say you are the 80 down here, your highest score is going to be the 92, and you'll get the 92 without impacting the score for the 94. And we'll go over that in a little bit. The only thing that I don't have on here is virtual groups, and your virtual group will supersede any other score that you have. But there are very few virtual groups. I think it's less than 1% of MIPS providers reported via virtual group in 2019 and before. So there is an opportunity for you to get your best score. And if you reported each one of these scores, CMS only takes your highest. While we're on this page, I did see a question that relates to it very closely that just came in is how does a practice determine if they're part of an APM entity? What they want to do is go to the CMS site or to healthmonics.com and look up your MPI lookup to see where you are as far as what category, how you need to report. If you put in your MPI number, it will tell you whether you are part of an APM entity or if you need to be reporting MIPS, whether you qualify for exemptions and so forth, right through CMS's website. And we also have the ability to track that at HealthMonix as well. So here what I was talking about, reporting as a group and an individual at the same time. So the benefits of reporting as a group and individual are seen here. If you're an individual, you'll get your own score. You know, if the group score is 89, some of them will score above and some of them will score below 89. And some of the patient measures, like we mentioned before, where you are 15 over 15, are harder to meet as an individual providers. And if you're going to report as a group, you can maximize your potential on those measures by including everybody within your TIN. Also a disadvantage of individual scoring is that you can't, those patients that you may have shared between you and other providers, you can't benefit off of that individual scoring. So with just group scoring, everyone gets a group score of 89, and that's it. The lowest scoring providers get pulled up to an 89, but the highest performing providers also get that score of 89. Now, if you reported both as a group and an individual, CMS takes your highest score. So if you are an individual that scores above that 89, you're not penalized by being part of a group that is doing not as well as you have. So you will get your individual score, let's say a 96. While someone that scores in the 60s, for instance, they will be brought all the way up to the 89 group score. And they can take advantage of the 20 patient minimums. You could take advantage of specialty providers within your group that may have very small patient populations of a certain specialty that they could score perfectly on. You could take advantage of that, and as well as those top performers aren't penalized. So I am going to turn it back over to Rob for a couple ending slides here, and then hopefully we have a couple minutes to answer some questions. So Rob, take it away.
Thank you, Mike. So in this slide, we are looking at determining your strategy. And the first place that you would need to start when determining your strategy is what method are you going to use to report? Here at HealthMonix, we are a qualified registry. So some of the benefits of reporting through a registry like us is that we're going to help you maximize your ROI. We're also going to have more measures available than I think it was 209 that I was talking about earlier. We're going to have more available for you. And when on that dot that says allow you to pick the measures in which you score best, we have a dedicated support team who will help you in every step of the way of your reporting process. So they would help you pick the most relevant measures and the measures that would net you the most points. Another highlight of HealthMonix or just using a registry in general is that we have the ability to combine data from multiple EHRs. It's not uncommon that we come across people who have been using one EHR and then switch halfway through the year to another. So what we can do is help you combine that data so that you're covered for the whole year. And lastly, one of the most important things that we will do is help dig into your data and address those gaps in care with you. So MIPS Pro offers live dashboards and drill down capabilities that help identify those gaps in care, like I was just talking about. Performance improvement, score optimization, and outlier detection. What you're seeing in this screen, you did see it earlier, where on the right-hand side, it's graphically representing how well you're scoring in each of the measures. So for measure 48 on this screen, that arrow is indicating that you're in one of the lowest deciles, what we do here at HealthMonix and MIPS Pro is our support team will help make sure that your arrow, if it's in the red, we help you get so it's towards the right in the green. So we're here to help you maximize your performance. And our easy to navigate dashboard is designed strategically for administrators to understand, track, and drive performance improvement, which leads to better scores, higher reimbursements, and improved patient outcomes. You did see the screen earlier, but to go a little bit further into it, we're looking at patient visit level data, and you can see that a patient came in on January 10th, and as Mike alluded to earlier, maybe the data was not structured correctly or something went wrong in documenting it. These are screens that we have available on our dashboard on MIPS Pro to help identify those gaps in care so that you really can optimize your performance. And I did talk about our support team earlier, but they are all US based. We're all stateside. I think most of us are just outside of Philadelphia or in Philadelphia. And then we have some New Jersey people as well. That's a little shout out to Mike. But our support team is there to reduce the burden of quality reporting and allowing you to do what you do best. So that's provide the highest quality healthcare to your patients. And the way that we go about this is kind of a 5-pronged approach with our data integration capabilities, our gaps in care analysis, risk score management, chronic care management, and MIPS and APM consulting. But we also have QCDRs or specialty measures. So we have a measure team that helps develop measures that get approved by the CMS that are tailored to specific specialties. So if there's any audiologists on this call, we have a QCDR for audiology to make sure that when they're participating in the MIPS program, that there are relevant measures that they can score well on. So one of the biggest questions is, and Mike was talking about this earlier, there wasn't a way to track cost the way that there was the other categories in MIPS. And we saw that as a huge problem within the MIPS program. So our team and our CEO, Lauren Patrick, was working really hard on a solution, and we came up with MIPS Cost Analytics. This is something as a company we like to hang our hat on, and that's because we are the first and only technology platform to provide current year payment data for all Medicare patients. So we're giving you the ability to track the cost category now. And how MIPS Cost Analytics will actually help with your score is that we'll be able to estimate your MIPS cost score throughout the year. You'll be able to track that live just as easily as you can for your total MIPS, but we'll also give you actionable insight into each of the cost measures, and will provides you with anticipated attributed patients and episodes, as well as individual patient HCC scores. So what we do is allow you to easily identify those patients and providers that really impact your cost score the most. And this is going to become more and more essential to every single practice. Is cost is going to be rising. We already saw that it jumped from 15 to 20% this year, and it's only going to go up further and further as the CMS is going towards a budget neutral program. This is an example of what the MIPS cost analytics page would look like For more information on MIPS cost analytics, please visit healthmonics.com. And please make sure not to miss out on our next webinar if you've been joining in our webinar series. That's on June 24th. And the aim of that is the APP for ACOs, building a solid implementation plan with our CEO, Lauren Patrick, and Mike Lewis. If you would like to get signed up today, or if you have any questions, please feel free to shoot us an email or give us a call, 888-720-4100, extension 3 for sales. And if you wanted to skip all that and you're totally comfortable with getting signed up yourself, you can just visit mipspro.com.
Great. Thank you very much, Rob. Sorry for the little jump, and thanks for the Jersey shout out, of course.
Of course.
I always appreciate that. So we didn't have a ton of questions in here, and some are very specific to each individual that asked them, and I'll get back to you. If I don't get to your answer during this presentation, since we don't have much time, we didn't leave ourselves much time today, I will be emailing you most likely by tomorrow afternoon. But a couple things that came in I thought were jump out as important across the board. But for instance, someone asked about registries and pulling data from retrospective through the year. So yes, that is the ability. If you signed up for someone like HealthMonix, we can pull your data from before the beginning of the year, starting in January, to help report for these measures. We do that often. However, you aren't taking full advantage of our system to attack gaps in care and so forth, to be able to take a look at your data throughout the year. And also, if there is integrations and non-partner integrations that we have to deal with, time is of the essence when it comes to that. And signing up in January may not give you the time to go through the integration process, as well as bringing in any changes that need to be made into the system. So recommendation now, since we're in June, is to really start looking at a registry immediately to get everything going. I did want to clarify, I think I kind of stumbled over it a little bit, but for bonus points, when you're talking about the bonus points for those extra measures, you must meet the 70% completion percentage and the 20 case minimum for both small and large practices to receive any of the bonus points. You cannot, for instance, report 1/1 for an outcome measure and receive that bonus point for that measure. You will not be able to do that. Also, I know I answered it a little earlier, but what does a practice know? How do they know if they are an APM entity, or how they report for each of their NPIs? There is a link on our homepage that allows you to look at getting started for MIPS reporting. And in that link, you could check what your eligibility is. We have, it's called an MPI eligibility lookup. And you will see a breakdown not only of yourself, but you'll also be able to see all the practices that you are a part of and how you have to or should be reporting for each one of those different groups. And you may have different reporting obligations at different locations. Let me just check one here a little bit. All right. So that's really all the questions that kind of match for everybody across the board. As I said, I will be getting back to everybody with all the other questions, but we really appreciate you joining us today. A nice hot day here in New Jersey, and we really hope that you have a wonderful summer, and we will talk to you real soon. Have a great day.